Habari zenu, naitwa Swabra.
Naitwa Flavia.
Na leo tutaongelea kuhusu kushughulikia kidonda, yani cha cesarean section baada ya kujifungua kwa njia ya kukatwa. Niambie Flavia, what is a cesarean section?
A cesarean section is a cut made on your abdomen and onto your uterus to deliver the baby. Okay. And there could be different reasons why that
was done. And it's important to know the kind of wound that you may have. Some doctors still do what we call a longitudinal cut, which is also called a subumbilical midline incision. And then there's also what we call the funnel, also loosely called the bikini cut.
One. Yes.
Exactly.
Or if you had a previous surgery that was already in the middle, then you would still do the same. You would not create a new scar, so we'll just use the same.
Perfect. Why it's important to care for the wound also depends on the kind of sutures that were used. Sometimes we can use absorbable sutures, which the body takes, and sometimes we can use sutures that may need removal after, depending on several reasons.
Especially in the midline,
exactly.
The midline scar. That would be a possibility, but it's not very common.
It's not very common
these days. Okay, so how would we take care of this scar?
I usually say once the dressing is put on, before the dressing is taken out, keep the dressing dry, keep it clean, keep it out of moisture. Good.
Then usually after 3 days, we would remove it, and most times at the time of discharge, we would send you to remove it and maybe spray a
solution, an antiseptic.
Dressing, something, to cover the CS scar as we go home.
Good. And so that means also you may need to keep cleaning the wound using an antiseptic solution. Keep it dry, out of moisture. That means if, for example, you're a bit big with an overhanging tummy, you may need to keep sweat away from the wound.
So you may have to keep wiping it. So the trick with it is hygiene, keeping it clean and dry, showering twice a day just to keep it.
Avoiding exertion.
Yes, as well.
So you may not quite bend unnecessarily, carry heavy weights, carry the child on the CS wound, just keep weight away from the wound.
So what are the things that would make a patient come to the clinic before her 2-week review? Because most times after cesarean, we'd see the patient after 2 weeks. That would alarm her and tell her, okay, something is wrong with my scar, I need to go to the hospital.
If a scar is getting quite painful as each day passes, if there's reddening around the scar, and then also if you've started forming pus,
or a discharge, or a smell, and that will tell you that, okay, it's probably infected and you need to seek care.
Okay. And so as you care for your CS wounds, we hope that you heal well. We are proud of you for delivering whatever method that was used to deliver your baby. Until next time.